Das ist die Frida. Sie wurde mit ihren Geschwistern in Rumänien am Straßenrand in einem Müllsack gefunden. Kam dann mit 4 Monaten über eine Tierschutzorganisation zu mir nach Deutschland. Sie ist super lebensfroh, neugierig und ein super glücklicher Hund. Leider war es so, dass sie nach ein paar Wochen angefangen hat zu humpeln. Ist hinten immer weggeknickt, konnte schlecht Treppen laufen, hat sich arg zurückgezogen. Und beim Tierarzt kam dann raus, dass sie eine beidseitige Hüftgelenksdysplasie hat.
But a short time after her arrival, she showed difficulties with walking until she could hardly stand up anymore. A bilateral hip dysplasia was diagnosed. Her condyle didn't sit properly in the socket, so it popped out often. The cartilages rubbed against each other, which after some time destroys the natural shock-absorbing function of the cartilages and can lead to hip joint arthrosis. A juvenile pubic symphysiodesis, a minimally invasive procedure on the growth plate, was supposed to help her but proved not to be enough. She shows pain and lameness, especially in the left rear, after lying down and exercise, but also after playing with other dogs. The reactive hip is the cause of Frida's problems. That's why we considered an artificial hip joint, a thought that was only reinforced by the orthopedic examination. However, no simple, cementless total endoprosthesis, also called TEP, should be used. Aligned to the bone and pelvic structure, we created a TEP in 3D printing. To do this, we first referred Frida for a CT study. The tests were successful, and we were able to create a prosthesis, which was installed last autumn. Physiotherapeutic measures following the surgery should help her to walk evenly. The surgery went well, and the checkup of the newly implanted hip was also successful. However, Frida still has problems on the right side. After a short time, she had an uneven gait. She also had pain in her right hip. The left leg turns outwards and Frida also reacts sensitively on the left rear of the operated hip. A second operation was ordered. When moving, the left, operated side turns outwards, while the right side shows a clear hang leg lameness. The movement is overall uneven and irregular. Examination of the left pelvic limb, hip, and knee is unremarkable and not painful. However, the right side is quite reactive. On the one hand, the Ortolani test is positive because the femur is not in the hip but is freely movable. On the other hand, the unequal length of both hind legs is noticeable. The left, operated limb is longer because the connection between the limb and the hip is stable here. Since the right pelvic limb is displaced upwards and does not articulate in the joint, this side is shortened and painful. On both projections, it is clearly visible that the right limb is not in the socket. The standing DAR technique should show this. A normal hip is colored in blue and Frida's hip in red, when TEP was not yet present, as seen on the video and X-rays. Although Frida is doing better, a second operation for the defective hip joint is unavoidable. However, if the second operation adjusts the length of the limbs, as well as allowing the femoral head to move in the socket, we can restore Frida's quality of life.
Jetzt aber 7 Monate nach der OP ist klar, dass es nicht ausreichend war und dass sie eine neue Hüfte braucht. Da ich studiere, ist es leider aber so, dass ich dafür nicht die Mittel habe, weshalb ich euch um Hilfe bitte. Frida ist einfach mittlerweile ein Bestandteil der Familie geworden, im Freundeskreis und nicht mehr wegzudenken. Als Frida zu mir kam, war ich selbst in einer sehr schwierigen Zeit. Und mittlerweile weiß ich, dass nicht nur ich sie gerettet habe, sondern dass wir uns gegenseitig gerettet haben.
Visit our social media channels and website to stay up to date.